Hey guys, Dr. Cary here. People often ask me, what is it like to go to the chiropractor? What's that experience like? And I wanted to take my time to explain that to you today. Uh, when you first come to the chiropractic office, we're going to want to understand your condition better. So we're going to ask questions, get a thorough history, um, really understand your current condition. If you've had it before, are there any other health concerns? So it's like a bit of a puzzle that we have to put together just to understand the backstory first. Second, we're going to do an examination. The examination is going to be based on that area of complaint. We're also going to look at things like your posture, your ranges of motion. We're going to do some orthopedic and neurological tests, and they're all going to help us to determine what the cause of the problem is. We call it the diagnosis. We often have other diagnoses as well, like differential diagnosis. This is like the backup plan. What else could it be? And that's always in the back of our mind if the treatment's not progressing the way we want it to go. But most often, that primary diagnosis, when the person comes in, is effective and it does work very well. Then we get into the treatment. We explain to the patient what we're going to do. We get consent from them, and then we start the treatment. Now, most people come in there in quite a bit of pain, but when we touch the area, it's going to be painful, like during the examination. But then when we actually go to do the adjustment, it's like a pressure release. It's the best way to describe it. When we adjust the spine or the joints, it's like, wow, that was amazing. That felt instantly better. And people often say, well, why didn't I come in earlier and do this? I should have done this a long time ago. So I can reassure you that almost always people say, wow, that felt so much better. Um, the pressure releases in the joint when we do the adjustment. Sometimes you hear a noise, sometimes you don't. And then usually people feel better after that treatment for hours. When they feel a little bit worse is usually the next day. When they wake up, the swelling accumulates overnight and the pain starts to come back again. So they think that the problem is coming back, or maybe that they've done something wrong. And it's not that you've done something wrong, but it's just the swelling is accumulating. The body sometimes starts to shift back to the old position again. And the way I describe that to people is like 2 steps forward, 1 step back. So when we do an adjustment, it's 2 steps forward, and then your body's trying to go back. And it's a bit of a tug of war. When we follow up with you, do another adjustment, it's another 2 steps forward, and then 1 step back. So it's a bit of a process, just like going into the gym or doing something like that, that does take some time. We're going to give you some stretches and exercises to do. That's going to help. We're going to give you some strengthening for that area down the road. We're going to talk to you about nutrition and things you can do to strengthen it. More protein, more water, more electrolytes at the beginning. We're going to even talk to you about icing and heating and some supports you can get to help the area too. Often we take a whole body approach. So if your lower part of your spine's out of alignment, the upper part's going to compensate. So when we start doing the adjustments in the lower part, often we'll say, is it okay if we adjust the upper part too? We're just going to speed up the realignment process to get everything back in order. If the treatments are not helping, if they're going 2 steps forward, 2 steps back, we just seem to be spinning our wheels, then we're going to reassess the person and we're going to take a different approach, maybe different types of adjustments. I've seen situations where we're doing adjustments, it's progressing, and then it gets to a standstill. And then we want to reassess and do something to change the methodology so we get past that standstill and we continue to progress. We have progress exams built into our process here in the clinic. So we will do reassessments, and we're just going to give you some feedback. We'll do your postural pictures again, the original testing, compare, and then we're going to say, here's how much better you are. You're 50% better, you're 75% better. Here's what we need to do to complete the process. And then it's just checkups after that. So we've been very successful with this method in the clinic for adjustments. We do a variety of different types of adjustments, hands-on, instruments, tables. We combine that with laser and shockwave, which is like light therapy and sound waves. We do orthotics as well. Some of those supportive devices I talked about, orthotics to support the alignment of the foot. We have braces like knee braces, back braces, pillows to properly support sleep and your neck posture. We have supplements too that can really help with the nutrition for the joints. So it's a whole body approach. We're very successful at what we do. We have very good reviews. If you look at our reviews online, I've been doing this for over 30 years. So we've developed these different methods to really help people. But if you have any questions, feel free to drop a comment below. We will respond within 24 hours, or you can DM me, type in the chat, DM me on social media. If you like this video, you want to see more, what I would do is like this video on YouTube or on social media, and also subscribe to our channel on YouTube. You can also follow us on social media. So again, the process is very easy, very simple. It works quite well. Nothing to be afraid of. There are some ups and downs as we go through the process, 2 steps forward, 1 step back. But ultimately, as we do the work and you support the process at home, things are going to go very well.